Hello everyone, welcome to Field Notes, an exploration of functional medicine. I'm Rob Downey, a family practice MD and Institute for Functional Medicine certified practitioner. I'm coming to you from Seaworthy Functional Medicine in Homer, Alaska. Seaworthy exists to help people overcome their health challenges and be fully vital. Today, we are fortunate enough to have with us Carol Comfort, a functional medicine certified health coach. Good morning, Carol.
Good morning, Rob.
So it's an autumn day here in Homer, Alaska, and we're about 10 miles apart physically, and we're in the same space on Zoom. So it's a beautiful day.
Yeah, thank you.
It's kind of a neat autumn day. I was coming up through the mist and watching the light come into the sky this morning and thinking all these different facets of Alaska are part of what I love, how each day and each season is different.
I love this time of year, the equinox, autumn equinox. I'm reminded that it's such a great time of year to begin new things. And what I'm noticing is kind of that's what our community is involved in right now. Besides the start of school, it's been really interesting watching people say, yeah, I want to start doing this for the winter, getting ready for this and getting ready for that. And so enthusiasm is high, motivation is high right now. It's actually a great time to be a health coach.
Right, yeah. Yeah, people have their salmon or their garden items in the freezer. They're a little less frenetically
Yeah,
doing.
less manic and less, yeah, they're ready
Yeah.
to hunker down. They're ready to get to work too,
Yeah.
self-improvement or whatever it may be. Yes, it's fun. So it's a great time of year. And, kind of in that vein, the bears are running around town. Have you heard about that bear on the loose?
I haven't, but I've seen so many black bears in the last few weeks. It has felt again very
Yeah.
Alaskan. They've been up close and
Yeah.
personal over on Grace Ridge, etc. So it's been really
Yeah.
something.
So I got a little bit of a bear story later on in the interview. We'll talk about that.
Oh, great. We'll give our listeners something to look forward to.
Okay.
So you are a functional medicine certified health coach through the Functional Medicine Coaching Academy, which is affiliated with the Institute for Functional Medicine. And I'd like to start by talking about the fact that the training for that began down at South Peninsula Hospital Functional Medicine, now Seaworthy Functional Medicine. And about 4 years ago, you were there and I was there, and we were launching the clinic. So all functional medicine all day. And let's start by having you share your perspective about what was interesting about the training, why you got the training, what it felt like to be a health coach there at the same time as kind of we all learned the ropes together about growing that clinic and serving our community.
Yeah. So it was so wonderful to start off. It's now almost 5 years ago, believe it or not, in your clinic, brand new clinic, and started off working with you and your patients in that health coaching setting, even before I was certified as a coach, right? So I think one of the first things I learned about coaching was watching you, because you actually have a kind of a health coaching veneer to your practice. So you're really great at eliciting authentic responses from your patients, and you had such great listening skills. So those are two of the most important qualities in a health coach. So my training before I even became certified or started my certification program, I got to say, was from watching you. And you were so generous in letting me observe your visits with patients with their permission, and watch kind of how functional medicine worked. So that was my first exposure to functional medicine, which made so much sense to me because it involved the whole person and not just a diagnosis or not just a physical symptom. So that just further encouraged me to pursue the training as a health coach.
Mm.
I got to say that even before the training began, you allowed me to look at the functional medicine food plans and get familiar with them. And that was one of my first jobs, I remember, was to help interpret those food plans, like the cardiometabolic, the MITO, the core food plan, and help your patients understand what they were all about and how they might apply to their lives. So that was my first introduction to, an informal coaching in a sense. So that was fun.
Mm-hmm.
The training that came from the Functional Medicine Coaching Academy just presented a more formal structure. And but man, every day I was able to put that formal structure into play with your patients, and I got a lot of practice, I got to say, even though that was, part of the plan was you've got to log in a certain number of hours of coaching. I had excess numbers of hours of coaching thanks to your generosity of sharing your patients.
Mm. Well,
Yeah.
that's very gracious of you. We've talked quite a bit about how it's always been a reciprocal relationship. And so then as the Functional Medicine Coaching Academy taught you the principles of coaching, some of which aren't intuitive, let's talk about that next. And I want to thank our listeners who are joining us. We do this so that the word can go out about functional medicine. So once again, it's good of them to join us and learn and get the good
Mm-hmm.
word out.
Mm-hmm.
So I remember you talking about the training really delved into identifying the person's motivations, who they are, what they believe, incremental change, authentic change, agency. Do you want to talk about that next, how that felt to learn that and do that in those settings? Is that a good next sort of
Yeah.
part?
Yeah. Well, because you had mentioned that as my training went on, I learned that there's actually other facets, less intuitive maybe, about coaching. One of the things a lot of people feel going into health coaching is that, oh, it's all about nutrition, for instance. That's usually the first thing that comes to them. Oh, I want to teach people how to eat. Okay, there's just a whole lot wrong with that idea. It's so much bigger. And I think most people understand that as well, that it is bigger, but it's not all about food. And it's not about even telling them or advising them what to do. In fact, in the training, they say if you're in an if you're advising, you're probably not listening as much as you need to be doing, and it's out of your scope. They're coming to you with physician recommendations, maybe they're coming to you on their own, but you're there to help them implement their wishes, so to speak.
Mm-hmm.
You're there to help them discover what is most important to them with their health. And it could be from mental, physical, spiritual health. So it's all encompassing, which I love. I feel like to become a specialist in the health coaching field is not really, that's not really where it's at. That's certainly not where it's at for me, because most of coaching is about helping them change behavior. Okay.
Mm-hmm.
So it's not necessarily about, let's put this plan into place. It's let's co-create a plan, and let's figure out
Mm-hmm.
how it's going to be easy for you to put this into place, and how this is going to be fun for you to put this into place. And once we start making these very small incremental changes, the most exciting thing is that they want to make a change in another area of their life, which maybe wasn't even revealed or understood that needed to be changed when they first started on the journey.
Mm-hmm. Mm-hmm.
I think I just kind of went off topic a little bit there,
No,
but
I don't think you did. I think the beauty or the organic quality of these interviews with thought leaders is that what emerges in real time are some of the core truths that our audience are deeply thirsty for. And what I was flashing on while you were talking is that these experiences that you and I witness when a visit goes well for me or an interaction goes well for you is that people's eyes light up, they appear more at ease, they'll start to spontaneously volunteer something that happened that was surprising. And so it reminds me of how it felt to have a friend or a family member show me how to hold a fly rod, or how to seat my pack so that my hip belt didn't hurt 3 miles in. There's this just kind of connectivity and gentle engagement. It starts with deep listening, a deep loving awareness of the other person's state of being. And then there's this very gentle, okay, where do you go from here? Where do we go from here? And I think it's the authenticity and the agency that's the spark for people, because then they have a sense of confidence and joy and internal locus of control.
You mentioned deep listening. That's, I think, one of the things that I most enjoy about becoming a health coach, and then now deepening my skills as a health coach, is that I get to work on learning to listen more deeply and bring curiosity and bring empathy and non-judgment. And these are all things that we all could be better at in all areas of our life, right? So to develop it for my work and have it spill over into the rest of my life, that's kind of a bonus. So the deep listening, I really like people to understand that when they come to a coach, that's really a huge part of our practice, is that we sit with them and listen to their story and reflect back a bit what we've heard, make sure we're on the right track, typical communication skills, right? But that we bring gentleness and non-judgment to the responses. There's absolutely no judgment being made or shaming for behaviors that are less than desirable, that they, confess, so to speak. And so I love it when there's an honesty, and then that just gives me more information and more information on the table. And where do we go from here? And I feel like it helps people unburden as well, when they know they can come and have that opportunity to kind of give a little bit of their history. And sometimes that doesn't happen right away. I'm noticing that the first or second visit might be kind of like a checklist. Here's what I want to do. And then they open up. And that makes sense, because it takes some time to develop relationship. And can I share with you something that I feel has really helped with people opening up? So in the beginning, when we worked together, we were in the clinic, and it was face to face at across a table, which is fine. I loved that. I mean, it was a private space and you could talk comfortably. But when I struck out on my own and I created my own space for coaching, after a couple of months, I decided, wait a minute, who really needs to sit another 40 minutes, 50 minutes to an hour of their life? Why don't we get up and walk while we are coaching? So all my clients agreed, surprisingly. I mean, of all shapes and sizes, sure, I could use some exercise. So we started walking together, and I would have a little piece of paper in my hand with a pencil and take notes every now and then, but it required me to remember a lot, which was a good skill to work on. And the neat thing about the walking is movement really stimulates creativity. And the more we walked, like 30 minutes into it, the client I was coaching was more likely to come up with their own ideas, their own solutions to some of the problems that they were trying to resolve. So just the more activity and the more stimulation to their brain, the more open and receptive they became to even some of my suggestions. Because there can be resistance, as you understand, from people making behavior changes. So it was really, so I love that aspect. Was the walking, and everyone agreed to do it time after time. In inclement weather, we went indoors and walked at the community facility that we have, the recreational facility. That worked lovely. And now with COVID, we went to the phone, and I had some of those walkers with me saying, "Oh yeah, no, they're walking around their house doing laps while the whole time on the phone," and that's pretty neat. So it brought another level of mindfulness to their quest for improved health, because they're like, maybe I should be moving a little more, even if movement wasn't one of the topics we were after initially. So super fun. Now I'm back to walking. We can be 6 feet apart, and the weather's been lovely. So 6 months or so into the COVID situation, we're just like, let's get back outdoors and let's meet each other face to face. And we use masks.
Yeah.
It's great.
I want to use what you shared as a chance then for our listeners to get to do some functional medicine 101. And what I mean by that is you and I are fortunate enough to be hundreds or thousands of hours into functional medicine and functional medicine principles. And some of our audience are at that level, and some of them are starting their journey. And I think the good news for functional medicine patients and people that benefit from functional medicine, clients, et cetera, those who learn on their own, is that there's these aha moments. And so what you shared reminded me of the advice I was given as a dad, that if you're going to help a boy that you're concerned to give them an opportunity to grow, you don't sit them down to talk, you shoot baskets with them.
Yeah, there you go.
and then I think about so much of functional medicine is informed by asking ourselves what ancestral people did. And they got up and moved and gathered and hunted most of the day, every day. And there's a lot of data that we're built to move and we're built to connect. And so I think that some of the people I take care of, they envision that their functional medicine journey is going to be this sort of academic, school-like, task-driven set of checklists of foods and recipes. It's going to be a to-do list. And what you and I witness is that it's a very organic process, and there's this spark of joy and engagement, and they do indeed engage these items. They absolutely do. Their food optimizes, they move more, they socially connect, they sleep better, they manage their stress, they meditate or do yoga or heart math. These things happen, but the how is different than they envision. And it's better and it's more fun and it feels more like it comes from within and it's intuitive. That's what I'm hearing you saying and thinking about as you describe it.
Yeah. And sometimes when it's a physician referral and they come to me with kind of a prescription of what they need to do, I'll listen to that prescription and then I'll try to dig in a little deeper and find out, okay, A, which one's most important to you, or B, is there anything else? And there's often something else that needed to come before that, for whatever reason, it hadn't been uncovered yet, or maybe the physician visit is uncovered it at that point, but they didn't discuss it with their physician. So it usually gets revealed in a coaching visit, and we'll tackle whatever is most important. It's really wonderful to help somebody kind of align their value system with the actions of their life. And that's also what a coach does, is let's get to what's important to you, and then let's start living those values. Let's start taking action that reflects exactly what you just told me, So For some people, it's, you know, I want to get my blood sugars down, but you know, why? Well, you know, I'm aging, you know, oh, I've got grandkids on the way. Or, you know, I want to
Right.
be there. I want to be
Right.
there for grandkids. So sometimes just a prescription to do something isn't enough, but if you can connect it to something in their life that's important to them,
Yeah.
then they're like, I am motivated to do that.
Yeah.
Yeah.
Excellent.
So if I could just add, so another really great thing is one of the books I'm reading right now. And by the way, I love it as a health coach. I kind of feel it's my obligation to read current science that functional medicine, some of the poster children of functional medicine are writing, right? So the Mark Hymans and the Chris Kresser and Deanna Minnick. There's some great people. There's just a host of them, right? And you've really exposed me to a lot of those. But anyway, so I'll read their material, and I love distilling that information and passing it on to my clients when it's appropriate. So the current book that I'm reading is one by BJ Fogg, who's the behavior expert from Stanford. And some people say he's like one of the top human behavior experts in the country right now. And he's got that book and a practice called Tiny Habits. Tiny Habits is all about taking, when you want to introduce a new skill or habit to your life, that you connect it to one that you're already doing anyway, that doesn't take any effort. So like getting up in the morning, everybody gets up, right? You open your eyes and you step out of bed. And so some of what I'm doing right now is helping people find that activity that they do each day and attach their new habit that they're trying to build to that activity. Oh, you get up every morning. Do you have a yoga mat next to your bed? Why don't you do a one down dog? That could be your one down dog. That could be your place to put in one low back stretch, you know, go into the child pose for about 10 seconds. You know, it doesn't even require much time, right? Oh, do you make a cup of coffee or a cup of tea every morning? Oh, what are you doing while the water heats up? Oh, could you be doing some wall sits or wall push-ups? Oh, you could get 10 in right there. You wanted to do a little strength training, you don't have time to do it during your day. Well, here's a place, right? But, you know, all this is not necessarily me telling them, but, you know, discovering it by a conversation. This is a conversation we're having. So that's been really, really helpful, the tiny habits and my understanding of it, which I'm still learning more about. But like I said, I really try to read current information on what's going on in the functional medicine world. That, you know, Rob, one of the things, I bet you get this all the time too, is people will come to me and go, there's too much information out there. I'm so confused. I'm overwhelmed. What do I do?
Right. Right.
Yeah.
Yeah. Right. Yeah. I think there's a couple dimensions of that worth commenting on. One is that again, you and I are taking a whole bunch of things that could be helpful. And a first cut is just that for me, it's the Institute for Functional Medicine, and for you, it's the Functional Medicine Coaching Academy. The folks that have certified us have winnowed that down to what they think is the best evidence, the most commonsensical, the highest yield, the least risky, et cetera. And sometimes I'll talk with people and say, what you've shared with me may or may not have value, but it hasn't made the cut with IFM. So it's up to you. But here's what I would do if it were me or my family. And then I think two probably even more important dimensions or more intuitive ones for our audience are that just then kind of sequencing an incremental change that can be attached to an existing activity that's doable, that's in alignment with who they are. So they're swimming with the current of them, or they're buoyed by their own tide of, you know, desire to be vital, however we want to describe that. Then of all these many things, it feels like, okay, well, today it's chia pudding, or today it's a wall sit, or today it's child pose, or today it's saying the word gratitude as I breathe in and saying the word peaceful as I breathe out. It's this thing today. And then because I've watched a lot of Jeff Bland over the last year, my favorite interview moment in the last year with Jeff Bland is one of the thought leaders asked permission to ask him a question during her interview. And he said, sure, go ahead. And she said, everybody says functional medicine's so complicated. What are they supposed to do about that, Dr. Bland? And he said, functional medicine's just a way of thinking about things. Isn't that just incredibly elegant?
Yeah. Yeah. I love it. It doesn't have to be complicated. It doesn't have to be complicated, right?
Well, yeah, and
But it is.
what?
We're on information overload here.
Well, it's kind of both, and I've got to say also that it's your and my job to filter out the garbage. There's a lot of
Yeah.
garbage information out there, and so it's your and my job as trained people. If something's garbage information that's harmful or frames the concept in a way that doesn't make sense, we have a polite, respectful way to say, this is not a practice I would do for myself or my family or my patients. I'm not aware of any data to support it. I'm concerned
Yeah.
it's got potential harm. That's just ethically part of our obligation, I believe.
Yeah.
And sometimes I've had conversations with patients, and in the moment they may have struggled a little with me being transparent and what I thought was ethical, but later they said, gosh, I reflected on that. That was really helpful. It was not a good idea to leave the country and take botanical agents for a tumor. I decided to see a surgeon. And then we use functional medicine to prevent cancer recurrence. I'm glad I reframed that in the moment. Surgery first, functional medicine next, kind of thing. So
Yeah.
anyhow,
Yeah.
and again, I think folks do end up with the action items that they expect as they work with us. So those things do happen. It's the how that's
Yeah.
not necessarily how they expect. Another story I wanted to share briefly was that I had the good fortune as an intern in medical school. My brother Dan took me to Christmas Island to go fly fishing. And so that was his way of saying, hey, Rob, you get this chance to just take a break and be in the tropics for a week. And so I hooked this nice big fish on day 4. It's very challenging fishing. The wind is blowing and all this stuff. And I hooked the biggest fish of the trip, and the fly line got caught around the butt because the wind was blowing. And so as this fish raced away, the leader exploded with this loud snap, and the fish was gone. And I'm looking down at this tangled line, just hopping mad. And the guy just is this really nice guy from the Marshall Islands, and he lets me just be upset. And a couple hours later, it turns out he spent like 300 days a year in the ocean, either gathering for his family or harvesting fish or teaching people to fish or guiding them. And I just said, you're so good at this and you're so patient and you're so kind. How did you get there? And how were you so patient with me when I was just such an idiot? And he just said, my grandfather taught me, and pretty much the same phrase I heard from my grandfather over and over and over again, is he would just very softly say, it's like this. It's like
It's like
this.
this.
It's like this.
I'm writing that down with quotes. It's like this.
And so it takes the focus, it goes back to the beginning of the interview, that we radically accept what is, we meet the person in the moment, we do what Arthur Ashe describes as start where you are, use what you have, do what you can.
Yeah.
And we don't get hung up.
That's
We don't,
right.
they don't
That's
get
right.
hung up, we don't get hung up. And I think that's the real trust. And then this sort of American beating up on ourselves thing dissolves a little,
Mm-hmm.
and they just
Mm-hmm.
get moving.
Yeah. A lot of what we call pursuing good health is instinctually and intuitive, but the noise of the world gets in the way, and culturally we ignore these instincts and intuitions, right?
Mm-hmm.
That's also a job of a health coach, is help them return to their what they know intuitively to be
Mm-hmm.
true,
Mm-hmm.
or in what their instincts are. And I mean, everyone will come to me and no one disagrees on what we all believe is a healthy lifestyle. No one has but it's getting there, and it's getting beyond the talking mind that puts obstacles in the way. And that's one of my roles as a coach, is to help identify some of the obstacles and getting rid of them, you know, or going around them, or changing them, lessening their severity.
Because again, the folks we help, they don't just run through a checklist and suddenly become like a fighter pilot or an Olympic athlete. That's not what you and I witnessed. And so the thought leaders that are currently on the cutting edge of that, David Perlmutter's book, Brainwash, really talks about a state of peace. Kelly Brogan, her new book about owning yourself, very much focused on that authenticity. I think the simplest story of all comes from the tradition of Zen, the Zen master who was met on the trail, and he lived up on a mountain, and he would haul sticks every day. And so a student who came to seek his counsel met him on the trail and said, what's the secret to progress? And the master puts his bundle of sticks down. And the student says, aha. and then the student says, well, if that's the how to become enlightened and clear-eyed, what do we do? And the master picks his bundle up and walks up the mountain. And so you know, I think we set our burden down, we become clear-eyed about what's happening, and then when we're in that state of peace and engagement, then we act. We fulfill our responsibilities. We look out for our community. We take a run. We meditate. We share with others. We drop off something at the food pantry. And there's this huge tradition in mindfulness of compassionate action based on clear-eyed engagement with what is. So we set our burden down and we pick it up. But I think most Americans are pretty much focused on hustling that burden up the mountain as quickly as possible, and then they get burned out and monkey mind and mind riot. Part of our job is to say, set it down, pick it up,
set it down,
pick it up. Maybe set it down for a good long while.
maybe and maybe they don't want to pick it up, or they'll pick it up differently next time.
Maybe it needs to be down for a while.
Maybe it does. And oh, go ahead.
No, this is you're the
well, I was gonna,
you're the star.
Something? Can I add something?
Yes, you can.
So I've practiced my own meditation for about 20 years. It's something I do every day. I feel like it's made me a more resilient human being. I love to give people the opportunity to reduce stress, reduce anxiety, once they've identified that maybe that is the kind of the foundation of some of their issues. Maybe they don't discover that, but for some people they're going, okay, I've got to slow down. And I just love those two words, slow down. And a coach is there to help them with that. And some people can be, off put by the term meditation. We can call it what you will, prayer time, meditation. But for most people, I'll just start them with a simple breathing exercise. And just that quieting and slowing down enough to focus on breath. And it's such an easy exercise that I like to begin them with, that usually they come back wanting more or another to level up, so to speak. And I'll ask them, like, how many minutes do you think you could do this for? And I'm not talking any length of time. And they'll go, oh, I don't know, 2 or 3. And I'm like, great. Let's start with 2 or 3 minutes. And I'll just do that breathing exercise with them right there in the visit. I go, let's try this. We did this last night. I did it last night with a coach, with a client in their coaching visit. And I asked them right afterwards, after we did about 10 cycles of this breathing exercise, how did that make you feel? And it gives them an opportunity to reflect and to attach a positive emotion to the practice. And according to my the information I'm getting from BJ Fogg, is that connecting that positive emotion to a new skill or a new habit, it wires it to continue. It helps wire the new skill. in their brain. So I asked her, how did that feel? And she said, surprisingly, I feel kind of energized by that.
Mm.
And this is someone who has a real intense work in the healthcare industry. And she goes, I'm going to book in my work day with it. I'm going to sit in my car. She came up with this herself. I'm going to sit in my car. I'm going to do a couple of minutes of this. And when I get back in my car at the end of the day, I'm going to do it again.
Yeah.
And she came up with that herself. And just by having a new tool in her toolbox, she's found a way to implement it. So I'm excited by that. She was excited by that. She saw results immediately. We had the opportunity to practice it in the visit.
Right.
And then she understood how it could help her. So that was fun. That happens quite a bit. Quite a bit. Yeah.
This is so important. Let's underscore a couple of things. It may be the most important thing we share with our listeners today. So let's just underscore a couple of things. And then you were kind enough to give me a few key questions for the interview to make sure we really explored what our listeners could benefit from most. So we'll segue into that in a minute. We've gotten to some of it. You talked about Dr. Fogg, et cetera. So there's no more reiterative theme that's come up with the thought leaders I've had the privilege to interview so far than the fact that we always have our breath anywhere we are, camping, driving, in the kitchen. We always have our breath. And so every single thought leader flags this. This is a universal principle in functional medicine and being healthy and vital. It comes from spiritual traditions. It comes from science. There's a reason that your Apple Watch prompts you to breathe for a minute. There's a reason it's showing up everywhere. And then some of the science of it you've already shared with us, a beautiful aspect that gets us under the hood. Many of our listeners want to know what's under the hood, what's the science, how does it work? So small incremental change in the moment, connected to something you do already, connected to a positive experience. This is the mechanics of success.
Exactly.
And then the vagus nerve is turned on by this. Our rest and digest, rest and restore nervous system is turned on. And another moment I flash on is that Mark Hyman was interviewed by Ariana Huffington. And about 25 minutes into the interview, she noted him take this smooth breath. And she said, you just took a deeper breath. And he said, I do that a lot in real time because this is our birthright, to engage that breath in the moment, any and all times that we need to be clear-eyed, at peace, at ease, engaged, bright. So it's always there, and you're giving them that experience, and they can dip into that well over and over and over again.
Hey, let me add something to that about a book I read, another book. I told you it's kind of like my job to stay up on this, right? So there's a book called Breath. It's by James Nestor. It just came out in the last few months, and I've been listening to that book. And so he took kind of he delves into the science of breathing and how we've kind of gotten away from our deep breath, how we've gotten away from nose breathing. We've become mouth breathers. He talks about the health benefits of correct breathing. And he talks about what happens when we're not tuned into breath and breathing correctly. It gets pretty detailed. It's a little overwhelming at times. But again, I'm taking some of what I'm learning and distilling it and going, what can I pull from this information that's helpful to just the everyday person, to the rest of us, because I'm probably not going to delve into this issue quite like the author does, right? It's so great. And one of the things I learned was of an app that takes this breathing, this is another breathing exercise I've learned about. It takes this breathing exercise and it's called resonance breathing. And the app is developed to help guide people through. It's probably the simplest app I've ever encountered because it doesn't require it's offline, online. You have access to just this very simple sound that's just, so they're using a musician's electronic kind of ambient noise that guides your inhale and guides your exhale. And they're two different tones.
Yeah.
You set it for however many minutes you want to do this breathing for, and it's got the ratio of the inhale to the exhale already worked out for you.
That's
And
so
then
cool. That's so intriguing.
Guided. It's really intriguing. So again, so for me, because I have a ton of tools in my toolbox,
yeah,
I have to be really careful of not introducing too many, and to get permission from the client. Okay, what are you up for? What do you want to do? You know, yeah,
right.
And I heard you doing that a lot in your practice. You know, like, hey, can I tell you about, you know, this, or how do you feel about that? I learned so much from observing you in your practice, in working with a patient and trying to distill what they're interested in doing. I got to say that is probably the most important thing of a health coach, is to let it be client led. And it's definitely a partnership, though.
Yeah.
And it's a co-creation of a new healthy life.
Yeah. Oh,
yeah.
I get the tingles so many times during these interviews. Like, this is so cool. I cannot get enough.
Cool. It is cool.
In terms of credit where it's due, I have to say that I think what my parents embodied was kindness and respect. And I think then that creates a foundational state, or what have you, then, of we're inviting people. And if it's not the right time, again, they're like, oh, or they might say, yeah, I'll do it. And 3 weeks later, they don't. And so we're just sort of putting things out there. But another functional medicine.
It's like a buffet. It's kind of like a buffet, right?
Right.
Here's this buffet.
Right.
Let's pick something that looks delicious to you.
Well, and I do think a lot of Americans and a lot of folks in the world in general have this fatigue of, one thing my son's been really helpful about is saying that he doesn't like to be should on. And we should on ourselves, and others should on us. And it's understandable, because we want to be our best, and many of us have a Puritan work ethic, and so we're driven. But what can fall out there is that there's a part of us that needs to identify in a more intuitive, organic way what really matters. And sometimes it's more about slowing down and seeing things the way they really are, rather than what we should be doing or our expectations, or just really lots of old frameworks that start to fall away as we proceed. And I think these apps are kind of like, in functional medicine, it's called a point of leverage. So if you do this one thing, the watershed or sea change downstream implications of your tennis coach finally putting your hand on the racket properly for your forehand, it's one thing. It's one thing, but what happens downstream is suddenly you can direct the ball, because you didn't have the right position on the racket for 3 years. So there's no way you could stay out of the net. So these points of leverage then create watershed and downstream implications for people in between visits, where they say, aha, this is easier. I'm working smarter, not harder. That's what happens in between.
Right.
In between visits.
Yeah.
So let's make sure and look at a couple of the things that you provided. We talked about the purpose of a health coach to some degree, and illuminate briefly then how can collaborating with a health coach transform a physician's practice. We haven't delved into that too much. We have we have a few minutes here to maybe take a minute or two on a couple of things we didn't get to, because these again are just awesome things for people to get to hear your perspective on, if you've got the time.
Yeah. Thank you. So the physician gets to see a lot of chronic disease, right? And your patients are coming to you trying to, well, because you're a functional medicine physician, they're trying to get to the root cause of the issue. The physician's so great at helping to identify that, but then the patient has this okay, now now that we've identified this root cause, what's going to change that? What's going to change? How can we make a positive outcome for this situation? And you're great at delivering the science. Like, why are my cortisol levels askew? And the health coach can step into that practice and that partnership, and the health coach can go, oh, Dr. Downey knows why, but I'm gonna help you with the how to relieve these symptoms. I'm gonna help you with how are you gonna change your behavior. Okay, so let's go back to, you and I have talked about this before. It's like a triangle. So you've got the patient at the top, then you've got a physician and a coach being the supportive foundation, right? And that's why, and we both have the patient at our, at the highest, regard, right? They're the ones that are most important here. It's all about them. And, when you think about it, there's chronic disease, the chronic disease that we're seeing, it's all behavior driven. So they say, I guess the CDC has determined that only 6% of Americans at this point are engaging in the 5 healthy behaviors that they deem necessary for a healthy lifestyle. It's the not smoking, it's exercise regularly, alcohol in moderation, sleeping well, and the 5th one is maintaining a healthy body weight. Okay, 6%, they say, the CDC apparently says 6% are actually following that. It's because people are on overwhelm and they're not sure how, and there's so much to think about, and they're making a living and they're raising a family, and that's where your health coach comes in, takes the patient from the physician and says, thank you for these recommendations. I'm going to help them put them into their life. I have the time to do that. We have the 30 minutes, the 60 minutes that a health coaching visit sometimes takes, and often for the physician, they're on a different time schedule, right? So they don't get to spend that time with their patient, even if they would like to spend the time. The industry isn't really set up to be able to negotiate that time with their patient. Does that help?
Excellent. Yeah, excellent. How, what's the scope of practice for a health coach in regards to nutrition?
Yeah, we are not there to tell them what food plan they should be on, but we're there to encourage a lot of healthy choices. So for me, it's simple. I think if everyone could just ramp up their veggie intake, that's a huge part of it, right? Get loaded on the deeply nutritious foods and fill yourself up with, nutrient dense foods, so that there's not much room left or even a desire for the, the less than friendly foods. So we're not there to be prescriptive, like, okay, you need this amount of fat, you need this amount of protein, you need this amount of, but we can guide them. We can guide them. I love it when they come to me like, oh, Dr. Downey has just said I need to follow the cardiometabolic food plan. So we can look at that food plan and go, okay, what's excites you about this food plan? And then go, oh, I love, and such and such. I love such and such. Oh, do you have any recipes? No, I don't have any. Oh, let's figure out how we could turn that into a really delicious meal. So I've actually gone in people's kitchens if I need to. I've put on a workshop that would show them, here's how you can incorporate more green veggies in your diet. Or maybe we'll look at what are some challenges? What is on this food plan that you just feel like is going to be really rough to get past.
Mm-hmm.
Oh, and why? Well, maybe it's just because it's not as accessible. Oh, I know how to find these ingredients. Let's try
Mm-hmm.
this. Oh, but then how do I use them? Oh, I put mine in a smoothie. It's a great way to get in, so
Yeah.
we're kind of parsing out the food plan that they are hoping to follow and helping them implement it
Mm-hmm.
with hacks. I call it, food hacks. Here's some food hacks for you. It's not our scope to recommend supplementation, but
Mm-hmm.
if I hear somebody saying, oh, I just don't sleep well, and oh, have you seen your physician? Maybe they could recommend some supplements. And granted, I know enough about magnesium and feel like, okay, probably the whole planet could be taking magnesium.
Yeah.
I learned that from you, but so it's not my, go out and get magnesium and take this amount. Nope, can't
Mm-hmm.
do it. But
Mm-hmm.
I can send them back. I'll go, why don't you have this discussion and get some labs, maybe get
Mm-hmm.
some tests, see what you could be using. Vitamin D, maybe you need to get your vitamin D levels
Yeah.
measured. So that's, I'm there to suggest labs. I'm there to suggest going to their physician, returning to the physician. I really like to defer to the physician and encourage them to be super honest and
Mm-hmm.
communicate with their physician. That's why I love actually your referrals. They have somewhat of a prescription to
Mm-hmm.
come, to start with. It's a good launching place.
Yeah.
Other people will come to me, and usually people are pretty educated though when they come, like, I just need to get my blood sugars down. All right, let's talk about that. Let's
Mm-hmm.
figure that out. Yeah.
And when you and I were preparing for the interview, you mentioned there's some certification aspects of coaching.
Yeah, there are. So I, thankfully, with your encouragement, was able to get certified by an agency that is part of. There's only certain. Okay, I'm not really totally clear on all this, but there's not every coaching school is accredited. So there's actually a national board that the AMA recognizes for health and wellness coaching. And gratefully, the Functional Medicine Academy is certified. So I think it's important for people to do a little bit of homework.
Mm-hmm.
Um, I mean, I feel like I've been coaching my whole life because this has been a passion of mine for so long.
Mm-hmm.
And so now I'm just doing it kind of more legitimately. But oh my goodness, did the training help? Did the training ever help kind of line out, this is what we do as health coaches and this is what we leave alone? And you don't want to get into trouble. And I think
Mm-hmm.
a really good coaching academy will line that out, what your scope of practice is, and it just legitimizes this new kind of industry this new addition to the healthcare field. It's so
Super
new.
helpful.
Yeah, it's so new, Rob, that most people are probably asking you, what's a health coach? I just
Mm-hmm.
love it when people give me the opportunity to tell them what's a health coach. And I'll just briefly, the elevator speeches were there to guide you on your path towards wellness, based on
Thankfully,
what
though,
they.
well, thankfully,
Yeah.
you illuminated why over the course of the interview, because even if the physician or medical provider had the time and training, which most of us don't, that's not the world we're living in.
Yeah.
And
Yeah.
and because lifestyle is the cornerstone and foundation of people's functional medicine house, that's the
Mm-hmm.
game changer.
Mm-hmm.
5 minutes of the medical provider's time illuminating that is not enough oomph
Yeah.
to facilitate that.
Yeah.
And in other domains of life, a person wouldn't expect to learn wheel thrown pottery in 5 minutes, or to be able
Yeah.
to play tennis with their friends or run 5 miles comfortably. It doesn't, we need
Yeah.
to be able to put in time and be supported. In the domain of lifestyle change and the domain of illuminating the path forward are related but different, and the medical provider and the coach each play pivotal roles. So
Yeah. Yeah.
So we've got just a couple minutes, and I want to be respectful of your time. And so we weren't able to get to quite everything, but most of it. And I think what we did was super high yield. So I'm just absolutely delighted we got to do this. So for maximum benefit for our audience, they should know that people that you talked about, let's say they watch this on YouTube, or they find it on the Seaworthy website, or they find it on your website. The transcribed blog, there's a fantastic editor for the blog.
Okay.
So if they track down, well, if they look at the podcast, the notes will always have your website, so they can learn about
Oh,
you and they can work with you. So I'd love for people to work with any functional medicine certified health coach. I think
mhm.
if people work with you within Alaska or across state lines, a value added aspect of working with you is that I know you really well. And I just would say that you're gifted. It's that simple. You are gifted at facilitating this transformation for people in a warm, wise, direct, honest, accountable way. So I hope if people are
Thank
excited about
you.
the possibility of working with you, that they
Thank you.
do. And then for those folks that really want to, geek out on the extra dimensions, right? They really want to drill down, then they can go to the blog, because this brilliant editor we have for our blog, she hyperlinks all that stuff you invoke. So those authors and books, they can literally go to the blog transcription, which lags this podcast posting by about 3 weeks, and
Okay.
they can just click right on the hyperlinks. So they should check out
Oh,
the blog.
neat. Oh, neat. Oh, neat. Great.
So let's close with this. You said if you had to pick one thing that you thought would move the needle for health or living our best lives, it would be to acknowledge that food is information to our bodies. Should we close with that, Carol?
That is so important. So could I, yes, we can close with that, but I get an addendum, don't I?
Oh, we
Can
have
I, can, can
Jack
I add one
Kerouac
other
said
thing?
in the road, digress all day, but this is not a digression.
No. Um, so those words, food is information, for me just changed so much. It just changed everything. If you think about our cells, or, our cells are being fed all day. Um, when we eat an inflammatory food, that's what we're telling ourselves to do, right? Okay, inflame that body.
Hmm.
And when we eat an anti-inflammatory food, I mean, it can be that simple. You can just ask yourself, if food is information, what are you going to pick up? You're going to pick up the apple, you're going to pick up the donut. So sometimes just those words, that food is information to our bodies and our minds, can be a game changer for people.
Hmm.
My add-on
Yeah,
is slow down.
yeah.
It's like slow down and breathe. There you go. You just did it. You just did a nice, when you say slow down. Slow down just gives us time to realign
Hmm.
and to turn on that parasympathetic nervous system that wants to soothe ourselves, right?
Hmm.
So food is information, slow down.
Excellent. Excellent. Every year I've been in Alaska for the last 8 years in Homer, I've slowed down more and more, and had more and more good food information coming in my body. And every year I've been more at peace and happier and had more fun and been more effective and productive. So I
Yeah.
I would hope in my own humble journey, I'm, what they would call in the lower 48 living proof of the process. And it's always process, not perfection. Um, the pandemic's also, meant that not everything my hand reaches for is an apple, but certainly more apples and fewer donuts.
That happens.
Well,
Yeah.
what?
Okay. The bear story. We gotta circle
Yeah,
back to the
let's wrap
bear
with the bear
story.
story. Yeah.
I'm walking with a client yesterday because, and it was in between rain showers, and we took a trail. And right at the start of the trail, warning: bear sighted in this area, with the date, which was that same day. So, okay, I turn around to my client? Do we do this? she's like, I don't know. I'm like, let's do it. So we forge ahead and we're talking about her food plan, and we're talking about how to get in some more yoga, and we're talking this and that. And, you know, I'm just looking around the whole time. All right, we're just going to keep talking. And we circle back to return to our starting point, and the spot on the trail that we'd been to 5 minutes earlier, big, fresh, steaming pile. I mean, that bear was with us. That bear
Right.
was with us on our walk. Anyway, it's just one of those funny and fun things about coaching in Alaska. But
Yeah.
it's pretty fun. It's fun. We stayed safe. We took a
Awesome.
new route. It's kind of like life. It's kind of like life.
Yeah.
You run into an obstacle, we're going to take a new route.
Excellent. Well, today
Yeah.
was fun and exhilarating and
Thanks.
illuminating and such a privilege, and I knew it would be, so I just
Thank
can't thank you
you.
enough.
Thank you so much. That was fun.
Seaworthy exists for people to overcome their health challenges and be fully vital. Please consider subscribing, giving us a 5-star review if we've earned it, and going to our website podcast tab for any questions or comments you'd like to share with us. Thanks.